How to recognize symptoms of heart failure exacerbation. Heart failure is a condition in which the pumping mechanism of the heart is weakened, and it is unable to circulate blood at a normal pace. As a result, fluid backs up into different areas of the body and an insufficient amount of blood is delivered to organs to meet their requirements for oxygen and nutrients. When heart failure progresses, it is known as heart failure exacerbation and results in a worsening of symptoms that may be sudden or develop slowly. It is very important to recognize these symptoms early, because early diagnosis and proper management strongly increase your chance of survival. Recognizing symptoms of heart failure. Become familiar with symptoms of heart failure. It's important to recognize when heart failure is progressing and experienced an exacerbation. However, to do this, the first step is to improve your knowledge of the symptoms of heart failure itself. This way you will be able to notice if those symptoms are worsening or if you start experiencing new symptoms. Assess your breathing. Listen to your breathing to see if it is more labored or faint than usual. Shortness of breath, called dyspnea, is one of the most common symptoms of heart failure. When the left ventricle of your heart is not able to pump the blood forward, blood backs up in the pulmonary veins, the vessels that return blood from the lungs to the heart after oxygenation. The lungs then become congested, and collect fluid that prevents them from working normally and causes shortness of breath. Initially, breathlessness occurs only after exertion. It is one of the first symptoms in most patients of heart failure. Compare yourself with other people your age, or compare your current activity level with your level 3 to 6 months back to recognize if you have modified your lifestyle due to shortness of breath at exertion. The congestion in your lungs may also cause a dry cough or wheezing. Notice feelings of fatigue. Some cases of heart failure are not accompanied by symptoms of congestion, but by low cardiac output, which can present itself as excessive fatigue and physical weakness. Low cardiac output means that the heart cannot pump enough blood to meet the needs of all your body tissues. As a response, your body diverts blood away from organs that are less vital, particularly muscles in the limbs, and sends it to organs that are more vital, like the heart and brain. 5. This results in weakness, fatigue and a constant tired feeling, which makes it hard to do everyday activities, such as shopping, climbing stairs, carrying groceries, walking, or playing sports like golf. Keep an eye out for swelling. Edema, the accumulation of excess fluid in body tissues, is often a symptom of heart failure. Edema occurs because your heart is not able to pump your blood forward, resulting in blood backing up in the systemic veins, the veins that carry blood from our whole body to the right side of the heart. Blood then leaks out into the tissues and causes swelling, which can be experienced as swelling in the feet, ankles and legs. Initially, you may find that your shoes feel tight. Swelling of the abdomen. You may feel that your pants have become tight. Generalized body swelling. Weight gain. Note if your heart rate becomes rapid or irregular. You may experience a rapid heartbeat, tachycardia, or an irregular heartbeat, arrhythmia, as symptoms of heart failure. It's important to note that both of these can also be complications of heart failure that can lead to cardiomyopathy, heart attacks, and strokes. See your doctor. Get medical attention if you notice these symptoms. If you notice any of the above symptoms, you should consult your physician for testing and diagnosis.